my approach to pregnancy, meaning using psychiatric medications in pregnancy. And the bottom line is that it has to be tailored to the individual. I have a very historical perspective on this subject because historically we used to use these medications and not worry that much, and then found out that potentially they could be harmful to a fetus when certain studies came out that showed that. So immediately, historically, we're talking something like 20 years ago, potentially, we pulled back on the use of medications in pregnancy. And what happened was we then learned the opposite may not be good either, because women were, potentially harming themselves and their kids because of their depression. And we realized that you can't just not treat a disorder because of a potential problem that may or may not happen. And I think that my approach currently in understanding this historical perspective is to tailor the treatment. It's about individualized treatment. I sit every mom down and I say, hey, here's the pros and the cons of staying on the medicine versus coming off of it. And we together make a decision that we believe is correct. It's not that I'm telling them what to do in any way. That approach has worked for me in the past. I will say that I do tend to like to come off medications during pregnancy, at least during the first trimester, because the first trimester is when a lot of the major organs are developing, like the heart, for example. So I do feel more comfortable if somebody can mentally get past the first trimester and potentially revisit reintroducing at a lower dose in the second trimester.